Hey, anyway, let's get healthy when it comes to talking about the eclipse. And that meaning, you know, we're hearing about all these people, hundreds of thousands headed here to Oregon, and the pressure it's going to put on medical personnel, from hospitals to, you know, urgent care clinics everywhere. And so they've been making preparations for months now. They've known about it for quite a while.
If we're going to talk health, Kathy, do you think we should bring in a professional, say a doctor?
Yes, that would be good.
Great. We have one here with us in studio. Dr. Andy Barnett, Medical Director of Legacy Go Health. So Kathy brought up a good point there. Urgent care versus emergency room. There could be a lot of need come Monday. So in what cases do we use the emergency room? In what cases do we use the urgent care?
That's a good question, as we're expecting somewhere between 600,000 and 2 million people to enter the area and become a part of our population. There's a high probability that emergency departments are simply going to be overwhelmed with volume. We want to make sure that folks understand that urgent care in a lot of cases is a really good option for more minor illnesses and injuries. Most of the urgent cares out there, ours in particular at Legacy Go Health, we have x-ray at every facility, so if you think you might have broken a bone but it's not sticking out of the skin, you can certainly come in and see us. We do want to make sure that folks who have really serious medical problems like chest pain, shortness of breath, stroke-like symptoms, they should be going to the emergency department. For the vast majority of other things that come up that are minor illnesses and injuries, we can take care of those, evaluate them at a Legacy Go Health facility or any urgent care, and then we can help you decide if it's that rare situation that you actually need the emergency department for.
What sort of things are you preparing for as a staff? And are you all hands on deck like we are in the newsroom here?
Yeah, you bet we are. We're going to be open 7 days a week, as we always are. Our hours are until 8 p.m. every day of the week. We're normally open until 5 p.m. on weekends, but we've got all of our staff on alert that if we see these volume surges that we expect to happen, we'll be opening our clinics late. All the information will be updated on our website at gohealthuc.com. You can look there and find out the clinic nearest you, whether it's going to be open late, what the hours are, and we've got everybody on high alert to make sure that we can meet the needs of the community in the next week.
How about preparing? How about acting to be safe on Monday, Eclipse Day? I'd say rule number 1, don't leave the house. So you go to rule number 2. I mean, if we want to stay safe on Monday, we do it how?
Yeah, so a couple of things. First of all, if you're going to view the eclipse directly, it's really important that people understand that sunglasses, ordinary sunglasses, are not appropriate and can result in severe damage to the eye, both the front of the eye and the back of the eye. And that damage can be permanent, and there's not a lot that can be done. So having a properly certified pair of eclipse viewing glasses.
Which you brought with you today, doctor, I should point out.
We sure did. So we actually will have teams out there in the field at Grand Central Station and in Pioneer Square starting this afternoon. We will be handing out these glasses. We got 5,000 of them to give out. These are ISO certified and are safe to view the eclipse by. Really important that if you do have solar eclipse,
there's something making you chuckle, doctor.
If you do have a pair of solar eclipse viewing glasses, they need to come from a reputable manufacturer. So that's number 1. Protect your eyes.
You know, one thing that I've wondered about these glasses, because, you know, totality is a couple of minutes, but then there's the lingering, you know, darkness, and then we come back into light. Do I leave the glasses on the whole time, and do I only need the glasses if I'm looking directly up? Like if I walk into the car
That's a great question.
Yeah, that's a really good question. So these glasses are really only intended for looking directly at the sun. And at any time that you're looking at the sun, you need to have these glasses on. There may be a brief moment during that minute or 2 of totality where there's only a little bit of light coming from around the sun. We still recommend that you wear the glasses during that period of time. But before and after the total eclipse, if you're looking up at the sun, you need to have the glasses on. You don't need them if you're walking to your car or doing other activities. In fact, if you did, you wouldn't be able to see a thing.
Well, I know, that's what I'm thinking of, you know, there's some risk involved with that too.
Well, I'll be honest with you, I don't even understand. A week from Monday, Monday the 28th, can I look directly into the sun? I mean, we should be wearing these all the time probably if we want to look in the sun any day of the year.
Any day of the year. In fact, you can go outside today with those glasses and look, and it's pretty amazing actually to be able to look up directly at it. This is not just for the eclipse, Drew.
I honestly don't get why, like, people shouldn't be looking at the sun ever.
That's correct.
Is it worse to look at the sun directly on eclipse day? Or really it's not, but you just know more people are going to look that way?
That's exactly the problem. People don't typically look up at the sun because it's painful. It's kind of a self-limiting behavior.
Which you would think deterred anyway, and you'd want to grab the glasses.
In TV, they make us look at the sun. the cameraman always stands between you and the sun and says, sorry, you got to look into the sun for this shot.
It's better lighting.
Bring your glasses next
Now,
time.
every live shot I do for this television station from now on will be done with these glasses on.
Oh, Dr. Barnett, thanks for putting up with him this morning. We appreciate it.
Thank you, Doctor.